Nurse, I got 21 liters. What did you get?
I got around 110.
110. Okay. Let me make sure it's all correct. Oh, it looks like it's time for our next appointment. Who is it?
It's Samantha Smith.
Okay, may you bring her in, please?
Yes, ma'am.
Thank you.
Samantha Smith.
Hi.
How are y'all?
Okay.
Hi.
Hi, my name is Dr. Sanchez.
Samantha.
My name is Dr. Sanchez.
I'm her mom, Rebecca.
Okay. So, this is my nurse, and what is your reason for your appointment today, ma'am?
I'm here today because I don't know if I might be going into early labor or it's Braxton Hicks contractions. So I'm here to make sure.
So, how long have you been having these symptoms?
Since last night.
Okay. And how many weeks are you?
30.
30 weeks. Nurse, I think she might be going into early labor.
Yeah, we should run some tests just to make sure.
Okay. Well, since we think that she might be going into early labor, we have different methods that you can use, and depending on your own preference and your family's, and they're all different costs, so it's up to you.
Okay.
And there's a recent study that's been going around. It's called Kangaroo Care, which is beneficial to premature babies.
Mhm.
It's skin-to-skin contact right after you give birth with the baby.
Okay.
And it's, I don't know.
Wow, I haven't heard about it. Can you tell me a little bit more about it?
Yes, we can go over that right now.
Okay, thank you.
What is Kangaroo Care and why is it beneficial for premature babies immediately after birth? Kangaroo Care is the action of having skin-to-skin contact between a mother and her baby. It is especially effective in premature newborns. It came about when there was an alarming rise in the death rate for these particular infants. The death rates are due to various types of complications seen in prematures such as breathing problems, less body fat, feeding difficulties, and developmental delays. Therefore, they are more likely to have learning disabilities. Studies show that prematures who use skin-to-skin have a 51% reduction in neonatal mortality rates for babies weighing less than 2,000 grams. It was also reported that there is a 40% reduction in risk of post-discharge mortality, 60% in neonatal infections, and 80% in hyperthermia.
Mel, your contractions are becoming stronger and stronger.
Yes.
So we need a decision on what's your possibility of having skin-to-skin care contact or...
Oh, okay. I suppose, yes, but I'm just worried about the cost. Is it going to be expensive?
No, it's relatively manageable. The cost is like around $40 because it has to be a professional in the room with you.
But if you get another type of method, it's more expensive, so this is why it's more accurate. It gives you an actual connection with your baby also, and you get that emotional attachment. So I'm pretty sure this method would be perfect for you and your budget.
Okay, sounds good. Yes.
Okay.
The pros for the baby improves them in decrease in heart rate, breathing patterns, oxygen levels, weight gain, and brain development. The mother's pros consist of a decrease in postpartum development, increase in breast milk production, and higher satisfaction. Studies also show that KMC effectively establishes an emotional and trustful attachment between the premature and their mother/parent.
So how do you feel about the choice you made?
I'm really happy about it. I think it's going really well. Yeah, I'm really happy. I even noticed that with my breast milk, it's like flowing more easily.
And those are one of the pros that a lot of mothers say that they do.
Okay.
So I'm very glad you're very happy, and I'm very happy for you and your birth. So I hope you have a wonderful, rest of your day.
Thank you.
You're welcome.
Not all premature babies receive the act of Kangaroo Care. However, it has been proven that the babies who do are more likely to develop in a positive manner. Kangaroo Care babies often were more alert and responsive, less irritable and fussy, showed a higher capacity for concentrating their attention response, and had an overall better organization of the neural behavior system. Even after 10 years, studies showed that the Kangaroo Care babies had improved sinus arrhythmia, less stress response, organized sleep, and better cognitive control.